Okay, so the next portion is going to be how to connect the Sage Q6 equipment to the suction to begin the oral care process. So after you've disconnected the yonker from the suction tubing, you're going to connect the toothbrush, which would be part of your step 1, to the suction tubing. After you've made sure that you've gotten a good suction, you can hold your thumb over the hole that provides some of the suctioning through the tubing. This will be useful to remove any secretions or any of the excess toothpaste throughout the oral care process. If you're doing the suction, applying the suction while you're providing the oral care, at the end you should have minimal need to rinse with any other liquids. That being said, we'll address some troubleshooting ways to remove some excess secretions needed. So this basically is going to act as a real toothbrush. So you still need to access the toothpaste from your normal hygiene kit that contains the comb, the shampoo, the conditioner, lotion, etc. And apply the toothpaste to the toothbrush portion of the toothbrush. You can apply it to the foam pad if you need, but really that's just going to be used to help remove some dried secretions from the roof of the mouth and the sides of the mouth as you're brushing, and it's going to help absorb some of the saliva as well. That way you don't have to rinse as much towards the end. So now the bulk of the process is, how do we mean for you to perform oral hygiene? So we want to divide the mouth up into quarters, essentially. The top half and the bottom half, left and right. The whole process overall should take at least 2 minutes. So you want to be sure to apply cleaning and debridement of the area for 30 seconds per quadrant. So 30 seconds to the upper left, 30 seconds to the upper right, and so on. This includes the outside of the teeth and the gums, the roof of the mouth and the inside of the teeth, the tongue itself, lower parts of the teeth and the sides of the gums and the insides of the teeth, and the floor of the mouth. Special consideration should be applied to the roof of the mouth because we know that most of the oral bacteria that leads to infection lives on the roof of the mouth. The tongue is the second highest area, and we have been advised by dental professionals that when sweeping the tongue, that you move the brush or the swab from the inside out and not back and forth, as to not move the bacteria around on the tongue or in the mouth, but to sweep it out. Sort of like if you were sweeping with a broom, you wouldn't switch back and forth, you would continuously move it towards the area that you're aiming for. And to be extra sensitive with the floor of the mouth, as that mucosa is a little more, has more of a tendency to ulcerate or to tear, so be a little gentler with the floor of the mouth underneath the tongue. So she's going to kind of demonstrate what areas to go over. We really want to emphasize that this is not just brushing the teeth, but rather you are swabbing and debriding any buildup of secretions that might house oral bacteria.
Mr. Smith, I'm going to do a very good job cleaning your mouth so that you can have some sips of water. So I'm going to put some toothpaste on the toothbrush here, and I also, if I can, I'm going to let the patient participate as well.
Absolutely. So make sure that if the patient's able to do this and the plan is for them to do this at home, that you are supervising and providing cues for how it should be completed.
But for now, my patient is dependent, so I'm going to go ahead and go all through here, and I'm getting the palate. I'm going the 30 seconds. I'm getting some crusting off. I'm noticing what I'm doing.
If you need a pen light to go throughout this, you can. Another thing to consider is the positioning. If a patient is upright and they're unable to extend their neck, this may be easier from a reclined position in bed. Depending on how they're able to control their head movements, if there's drooling going on, The other question that I've had is about how do we rinse afterwards. This swab can be used to absorb some water, if you have a cup of water, and to basically moisten the area and then remove via suctioning. Because what's gonna come after the brushing is the oral rinse using the chlorhexidine mouthwash.
And I'm applying suction, so I'm getting the liquid is not swallowing it.
Right.
So it's not about me getting the teeth,
As wide as
It's-
possible.
it's just about me debriding and removing as much bacteria as I can. So that's been 30 seconds on each side. Now I'm gonna go to the other side, so the mouth down here.
For special consideration should be paid for patients that are known to pocket. There might be a buildup of saliva, which would yield a buildup of oral bacteria on the side pockets of the mouth. And the same thing for the top as well. And that's really kind of what the sponge, the backside of the sponge with the toothbrush is for, is to rub the gums on the cheeks alongside while the teeth are being brushed to get kind of an overall removal of those secretions that have been in kind of stasis. Really the best way to prevent any of the excess is gonna be to continually apply the suction toothbrush, the suction throughout the toothbrushing process. This is something that a lot of patients often forget because it's not part of their routine oral care at home when they're using a toothbrush. So reminding them to kind of hold that pressure, and you can look at the suction meter and it will tell you how much suction is being applied to be able to tell if they're really giving an adequate hold over that area. So after you've completed the brushing portion, the next step will be to use the chlorhexidine mouthwash. Again, if this is not indicated for the patient in question, that will be notated on the oral infection protocol for the water protocol portion in the patient's room. The SLP and the nurse will work in conjunction to kind of assess that and determine what's the best plan of care to go forward with them. There will be special considerations for different patient populations where wound nursing might be consulted to kind of give guidelines or recommendations for what sort of tools we should and should not use if there is an oral wound present, for instance with our head and neck cancer patients. Generally, we want to apply the mouth rinse for at least 30 seconds. When it is possible for them to contain and swish, we want to allow them to use that any way we can. If it is absolutely not possible, or if the patient is highly impulsive and unable to contain that liquid in their mouth without swallowing it, then we would go to absorbing the chlorhexidine mouthwash with the regular swab. I have been told this is safe to swallow in small amounts. It may cause a little bit of temporary gastric upsetness, but it's not going to lead to, it's not harmful in any way. This is basically what we would do to try to, deliver some of the chlorhexidine to the mouth throughout. There are contraindications for certain populations. If you have any questions about who that would include, that will be reviewed by the SLP and the MD in conjunction. If the patient is able to use compensatory strategies for their oral care, such as a patient with facial weakness, if they're able to lean over a sink or a basin to tilt towards the strong side to allow the liquid to pool on the strong side and swish unilaterally, and then let it release towards the end of the oral care. Those are the kinds of things that we want to be practicing with them, as that's part of their normal daily ADL. We want to be teaching them the tricks and compensatory strategies that they can use to complete these types of basic hygiene tasks adequately.
I've already done the whole mouth once.
Alright, so now the whole mouth is clean. If there are any excess buildup of secretions, or they need to spit, rinse, what we would do is reapply the Yonkers to the suction kit and suction for any excess secretions. After that, you basically want to give a last peripheral view of the mouth, see if there's any gum bleeding, see if there's any associated pain or new things that you didn't see before. Hopefully less mucosal buildup and more of that healthy pink mucosal tissue. And that concludes the hands-on instruction portion of how to perform the oral infection protocol.